All right, my name is Kurt. I'm going to be the nurse today doing the head to toe assessment. And this is?
Allie Johnson.
All right, what's your date of birth?
4/19 of 90.
Perfect. Can you tell me the date today?
It is March 29th, 2015.
Perfect. And where are you?
I am in the doctor's office.
Supposedly.
Yeah.
Yes. All right, so I'm going to be doing a head to toe on you. Just letting you know that I'll start up here, go all the way down. I'm looking at your skin for pigmentation, temperature, tenderness. I'll be palpating. I'll also be looking for dryness, any moisture. Yeah, any lesions or masses or anything. You just let me know, okay?
All right.
All right, let's go. We're gonna start at your head. Is it okay for me to touch you?
Yes.
All right. And I would provide privacy if this was a public setting. So here we go. Just feeling any. Just let me know if there's any tenderness that you have. Okay. No tenderness. No lesions. No masses. Her hair is intact. It's not dry. It's conditioned. Go down. Yeah, I don't see any lice or anything. So very good. All right, I'm going to check your temporal pulses here. Pulses were found. They are regular, smooth, and rated number 2+. Okay, I'm going to check your sinuses. Get your frontal sinuses. Any tenderness?
Nope.
Okay. Maxillary sinuses, tenderness?
Mm-mm.
Okay. You look at your eyes. You look at me. Okay. Eyelids are symmetrical. They're not drooping. Cheeks or mouth and everything, they're all symmetrical. Can you lift up your eyebrows for me? Smile for me. Okay. Facial features are working. I'm going to look at your conjunctiva here. Great. Just a slight pink, not red, which means no inflammation. Was that tender?
Nope.
Okay. Sclera, they're both white. Her irises are equal. Pupils are equal. There we go. Okay. So we're going to do a couple eye testing, okay? First we're going to check the corneal reflex. Okay. Pupils rate at a 3. They were reactive to the light and bilaterally they accommodated. We're going to actually check your vision here.
Okay.
I'm going to have you read the bottom line that you can read.
Okay, so the bottom one is 426739 EWM00X.
Perfect. That's 20/20 vision, so good. Now I'm going to look at your red reflex in your eye. I'm going to have you look at my nose, okay? Okay. Red reflex was found in there. And it's found in there too, so that's good. Alright, I'm going to do some tests on you.
Okay.
With eye level, being at eye level, I'm going to have you, I'm going to first have, well, we'll do your, it's called the 6 gaze test. It's basically, you follow the pen, okay?
Okay.
This one. Perfect. All right. Now I'm going to have you cover an eye for me. I'm going to cover the same eye on the opposite side, and you tell me when you see the object coming into your visual field. Okay. Perfect. Other eye. Perfect. All right. Now close your eyes again. We're going to do the midline.
Okay.
So we're coming straight down. Again, I'm closing my eyes as well. Okay. Other eye. Perfect. All right. Well, you passed.
That's awesome.
Okay. We're going to now inspect her ears. I'm going to look in her ears. And then I'm also going to do a couple hearing tests. first we'll look in your ear. I'm looking at the outside of the ear. It is intact. I'm palpating it for tenderness. Is there any tenderness?
Nope.
Okay. I'm going to look inside here. The ear canal is clean. I can see the tympanic membrane. It is intact. It's not perforated. It's a gray in color and shiny. So I return. There you go. Palpate her ear here. Any tenderness?
Nope.
Okay. It's intact. She does have ear piercings. I'll look inside. Looking up and back. Her ear canal on this side is also clean. Tympanic membrane is found. It's the exact same as on the other side. It is gray, it's intact, not perforated, and it is shiny. So I'm going to do a couple hearing tests on you, okay?
Okay.
First one is going to be the Ryan's test. I'm going to do I'm going to put this on your mastoid back here. You're going to tell me when you can't hear it, and then I'm going to put it in front of your ear. And then you tell me when you can't hear that one, okay?
Okay.
All right.
Gone. Gone.
Perfect. Okay. So I did time those, and the air conduction was twice the bone conduction. Same thing on this side.
Gone. Gone.
All right. I'm going to do a whisper test for her.
Okay.
I'm going to name off some things, and you just recite what I say, okay?
Deer. Duck. Dog.
Okay.
Bear. Bird. Squirrel.
All right. Good job. Now I'm going to do, it's a Weber test. I'm going to put this on your forehead. You let me know when you can't hear it.
Okay.
And also let me know if you can hear it in one particular ear longer than the other, okay?
Gone in both ears.
Both ears?
Yep.
Perfect. Which is a normal finding, so. Okay. Now we'll look at your nose here.
Okay.
Look up. Okay. Septum is intact, it's midline, no deviation. Slight mucus. Pink in color. Looking at the outside of her nose as well. It's straight. I'm going to see if there's any tenderness. Any tenderness?
Nope.
No, no tenderness. Okay. So that is good. I'm actually going to have you close your eyes.
Okay.
And I'm going to have you tell me what this is. I'm going to have you smell, okay?
Coffee.
Copy. There you go. Your nose works. So now we're going to look in your mouth.
Okay.
Open your mouth for me. Just able to stick out your tongue. Say ah. The uvula does move up and down. I do note that there are no tonsils. She does not have tonsils. Maybe open your mouth. And palate is good. It's intact. It's smooth, moist. She does have a cavity on her back rear molar, and she does have a retainer as well. All right. I'm going to find your nodes.
Okay.
I'm going to start back here with the occipital node. You let me know if there's any tenderness, okay? I'm going to move up to the pre-auricular, the post-auricular node. Then we have the pre-auricular node that's on the front. Yeah, and we have the parotid nodes. Yeah, and we have the tonsillar node. And we have the submandible nodes. There's submandibular nodes. And we have the submental nodes. We have the anterior cervical nodes that run along the neck. We have the posterior cervical nodes. And then we have the supraclavicular nodes. That is it. Any, no tenderness?
Nope.
Okay.
None of them.
Awesome. All right, we are going to we're going to move to your shoulders.
Okay.
And have you come up. Okay. She's able to shrug. Trapezius works. I'm actually just going to inspect her neck right now. Being on there, I'm going to look at her trach, which is intact here. I can feel the rings with my fingers. I'm going to feel your thyroid gland. Is there tenderness?
No.
No?
Nope.
Okay. No tenderness. I'm going to check out her carotid pulse here, which I was able to palpate here. So it's present. It is regular, smooth, rated number 2. 2+ that is. Same with this. I was able to palpate on this side as well. 2+, smooth, and regular. I'm also going to have you lift up your head to the ceiling. I'm going to look for any jugular vein distension, which I do not see any. So, okay, I'm going to osculate her carotid artery. I was able to hear the carotid artery. Again, it was smooth, or the rhythm was regular. All right, we're gonna move on down.
Okay.
I'm gonna have you do your range of motion. There you go, back, front to back. Yep, and side to side. Perfect. Just range of motion in your neck. All right, hold out your hands for me. Press down. Okay. Press up. Bend your elbows for me. Press out towards me, in towards you. Okay, I'm gonna get your wrists. Just to make sure that she's able to move her wrists up and down. She is. Does that hurt?
Nope.
Okay. It's a full range of motion in her arms. We're gonna bend, go up. Okay. Bend, go up. All right, full range of motion. I'm gonna palpate.
Okay.
We're looking for tenderness. You let me know if there's any tenderness. No?
Nope.
Okay, everything's symmetrical, entering lumps or bumps. Her skin is all consistent. And use skin turgor actually. Skin turgor is good in both hands, both extremities. I have you squeeze my, there you go. Fingers work, can you do the, perfect, she's able to do that. All right, now I'm gonna check both brachial pulses here. Brachial pulses are present. They're smooth to the touch. Rated 2+, regular pulse. And do her radial pulses as well. Again, bilaterally equal, regular, smooth to the touch. Okay. I'm gonna have you, I'm gonna actually do your reflexes.
Okay.
So we'll do this one first. This is going to be the bicep reflex. Okay, and as you can see on the camera, that was positive. This is the tricep reflex. You feel that?
Mm-hmm.
Okay. And this is the brachial radialis. Brachial radialis tendon reaction. You feel that?
Mm-hmm.
Okay. Same thing over here. We have our bicep. Have our tricep and the brachioradialis reflex. Okay. So now we're going to do a couple tests with your eyes closed.
Okay.
These tests are these. Basically, what I'm going to do is I'm going to have you close your eyes.
Mm-hmm.
I'm going to put an object in your hand, and you tell me what the object is. Okay.
Okay.
All right.
A coin.
Yep.
A cotton ball. A paper clip.
Yep.
And a coin.
That is the. It's a stereo. the gnosis test. Okay, we're going to do another test here. This is a sensation test. Close your eyes. I'm going to ask you if you can feel a sensation.
Yes.
Okay.
Mm-hmm.
That was a hard sensation. Here's a light one.
Yep. Yes.
Okay. And we're also going to do another test with your eyes closed. I'm gonna draw a letter on the back of your hand. You tell me what the letter is. Okay.
A T.
Perfect.
And a C.
Perfect. Okay. All right. I believe that is it for that. We are going to move down to the interior of your chest here.
Okay.
So we'll start with. It is called the tactile phrenitis. It's the tactile phrenitis. I'm going to have her state 99, and basically that's just I'm listening for equal vibrations in both lungs. So it's a 99.
99.
Perfect. Okay. All right. So I'm going to actually palpate first. See if there's any tenderness. Is there any tenderness?
Nope.
No. Okay. Actually, can I have you sit
Yes.
up here? Perfect. Awesome. All right. So I'm also looking for maybe inhale. Okay. I'm looking for symmetrical, which it is symmetrical. There's no tenderness that you. No. Okay. Everything is intact. I'm going to oscillate her lungs. Deep breath for me. Okay. Actually, with my stethoscope too, lung sounds were clear bilaterally. I'm also going to listen to her heart sounds. I'm going to be using the bell in 5 positions and then the diaphragm in 5 positions, and I'm going to be taking the apical pulse for 30 seconds. So I'll be instructing as I'll be going, but I'm just going to go in a sequence. So first, using the bell of the stethoscope, listen to the aortic region. Pulmonary region. The tricuspid region. And the mitral region. Okay, I'm going to do the same thing with the diaphragm of my stethoscope. Now at this location, which is the point of maximum intensity, I will also take the apical pulse for 30 seconds. Alright, so everything sounded good. I was able to hear her heart. She was 84 beats per minute. That was about it. Your lung sounds were clear. So we are just going to, I'll move to your posterior side. Actually, I'm going to have you come back down and then with your back facing me. Alright, so inspection. No tenderness?
Nope.
Okay, can you inhale for me? Alright, inhale. Perfect, alright. So just noting the color, there's no tenderness. I'm going to osculate as well the lungs. Alright. the lungs were bilaterally clear, we're going to percuss. All right, sounds are reverent, or renant. They're hollow, basically, which is normal. All right, so that's about it. I'm going to, yep, I'll have you turn around. No, actually, I will have you get up here. I am going to percuss the front of your chest
Okay.
as well. Hopefully find the exact same findings as before. Okay, so with her right here, before she lies down, I'm also going to instruct her basically about a breast self-examination. Basically, you do it once a month, one time a month. You press your breasts. I'm not going to do it, obviously. Press them in, press them out, up and down. You're looking for any tenderness, any masses. You're also looking for, you go inside of these are the axillary nodes. You'll be finding these, they can do this as well. They can feel inside their armpit. They're looking for tenderness, is a good sign, so awesome. I will have you lay down for me. Okay, so I'm going to do our abdomen now. First thing I'm going to inspect everything. I don't see any pulsations. Everything is symmetrical. Maybe breathe in for me. Okay, everything is symmetrical. No abnormalities, no lesions. Her umbilical region is normal. No abnormalities, no lesions. Okay, so I'm going to auscultate the 4 quadrants. You want to do this before you palpate. She has hyperactive bowel sounds in all 4 quadrants. At the same time, I'm also going to listen to her abdominal aorta in this region. I am able to find it. It's very faint. It is regular in rhythm. So, at the same time, I'm just going to kind of move down before we palpate, so I can use a stethoscope. I'm going to find her femoral arteries. They're going to be right in here. Alright, so I found them bilaterally. They do rate at a 2+. I can feel them. They're smooth. It's hard to tell. I'm not going to go into her pants, but they are smooth, they're regular, they're palpable. I'm also going to osculate these as well, for as much as I can do on the outside of the pants. And I am able to hear this one. It is regular in rhythm. I'm able to hear this one as well, and it's 2, regular in rhythm. Alright, and I'll also note that the inguinal nodes, lymph nodes are in here. And I can palpate those as well. Your horizontal and your vertical nodes. No tenderness?
No.
Oh, okay. Now we're going to palpate. So basically I'm looking for making sure it's symmetrical. No masses, no tenderness. I'm going to do a light palpation, which is 1, 2 centimeters. Let me know if there's any tenderness. Okay, I'm going to do a deeper palpation. No tenderness?
No.
Okay. I'm going to percuss the abdomen. Alright. Now there was actually it's a hollow sound up in the upper two quadrants, and it was actually a dull sound on the bottom two quadrants, which would indicate that she does have urine in her bladder. So we're going to keep on going then. You can actually sit up. You can pull that down. Okay. I'm going to actually have you stand up. She's going to show me some range of motion through her hips. If you can just go like this in front of the camera. There you go. She's able to move her hips, move her legs out. Okay. Let me sit back up here. All right. We're just going to look at some range of motion here. Can you press or push against me? Okay. Press in. Yeah. Can you lift up here? Both of them. Yeah. Okay. And then can you straighten your legs out for me? Perfect. All right. So we're going to go for the I'm going to check her popliteal pulses when we're up here. Now, these pulses are actually really hard to find. I am able to feel them briefly, so I would rate them at a 1+. It's hard to tell if they're regular or not. So we'll go down. Looking at her legs, they are symmetrical. Are there any tenderness or anything?
Nope.
No? Okay. I don't know if there's any tenderness up here.
Mm-mm.
No? Okay. So we're coming down. We'll do the tibial pulses. Was able to find both tibial pulses. They're smooth. They're regular. And they would rate at a 2+. Okay. And then the pedal pulses. They too are smooth, regular in rhythm, and they would rate at a 2+ as well. Okay. I'm going to have you, can you lift up on your feet? Okay, push down your feet. Can you wiggle your toes for me? All right. I'm going to do your reflexes now.
Okay.
This is her popliteal reflex. Okay, that was present. And that one's present. Now we're just going to do the ankle reflex here. That one was present. And that one was present. I'm just going to look for sensation on the bottom of her feet. Are you able to feel that?
Mm-hmm.
That?
Yep.
Good. I'm going to do a light sensation on the bottom of her feet. Can you feel that? Okay. You feel that? I'm going to have you do a test. Will you touch the inside or actually the outside of your, yeah, just like that with your heel. Perfect. Thank you. Okay. Like I said, everything was symmetrical there. Are you able to stand up for me? I'm going to do some more tests.
Okay.
I'm going to have you actually with the camera, yeah, walk heel to toe, heel to toe. Okay. Perfect. Now with her, with you looking at me, or there you go. You can go this way. I'm going to have you with just like that. I'm going to have you close your eyes, and this is the Romberg's test. I'm just going to make sure she's not going to fall over. Which are your eyes closed?
Mm-hmm.
Okay. She's not falling over, so she's okay. Other than that is about it. You can sit down if you like. Oh, actually, I do have to check your spine.
Okay.
I'm going to have you touch your toes for me. Perfect. Now, with your down, just going to make sure that her spine is straight. Is there any tenderness?
Nope.
No? Okay. It goes all the way down. So, that's good.
Great.
And that is it. That concludes this assessment.